Hi everyone, Professor Novak here. So I just wanted to talk a little bit about SVT and adenosine for senior proficiency. I've had a lot of questions about this, and I know that there are some students that are uncomfortable. So hopefully this video helps. So let's jump right into it. So I have two strips here. These are two different strips. These are both 6-second strips. So let's start with the top one here. So what I look at off the bat is that I see that there is regularity in this. So I'm going to take note of that. This is nice and regular. So I see nice QRSs, and then before each QRS, I see an upright P wave, which tells me that it's coming from the SA node. So this looks to be a sinus rhythm to me, but I want to know the rate. So I'm going to count here. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So my rate's a little fast, but everything looks to be normal. So I'm going to say this is sinus tach. Okay. When patients are in sinus tach, this doesn't necessarily mean that they have problems with their heart, but we want to treat the underlying cause. Okay, so the body is compensating for something. It could be that they have a fever, maybe they're in pain, but the body is compensating for something. So we want to treat that cause. We want to give them Tylenol, give them pain meds, maybe IV fluids if they're dehydrated, things like that. Okay. When we look at the bottom one here, so again, I have a 6-second strip. First thing I'm going to do is check for regularity. So it actually looks pretty regular in between these QRS complexes. So I'm going to say that this is regular. And let's get a rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Okay, so my rate on this is 190. So how do you think my patient's going to look with a heart rate of 190? They're probably not going to be well. But let's go ahead and just back it up real quick. So let's look before each QRS. So it's kind of hard to tell whether this is a P wave or a T wave. This is actually a T wave before each one. What happens when it's going this fast, you actually won't see P waves, okay? This is very, very characteristic of SVT. So this is SVT here. So let me pop on over to this. So here's what's happening in the heart, okay? Heart's primary pacemaker is the SA node. The SA node, initial stimuli starts here, it goes down to the AV node, and then goes down to the bundle branches to stimulate the heart. What happens in patients that have SVT, sometimes they're either born with this extra circuit or the body will take this extra circuit depending on medication related or something that's going on with their condition. So instead of having this nice smooth conduction through the heart, we actually end up going in this accessory pathway and the heart rate goes really, really fast, okay? So going back to this, what are we actually going to do about this? Okay, so you will see this in senior proficiency. There is one patient that goes into this. So initially what we're going to do right off the bat, number one thing we're going to do are vagal maneuvers. And you have to be very specific when you tell a patient to do this, okay? You say, oh, we need you to bear down like you're having a bowel movement. They're not going to understand what that means. So what we're aiming to do here is we're aiming to decrease the rate through the AV node. Okay, we're trying to stimulate the vagus nerve, which slows the heart rate down and hopefully terminates this rhythm. Unfortunately, this doesn't always work. Okay, so our medication of choice here is going to be adenosine. So if you're in senior proficiency and you see this rhythm on the monitor, you ask your patient to do vagal maneuvers and it doesn't change, you should anticipate that your patient's going to need adenosine, okay? There are 2 dosages for this. The first is going to be 6 milligrams and the second is going to be 12 milligrams if it doesn't work. Adenosine is packaged for you in senior proficiency pre-filled, okay? Be very, very careful when you open the patient's bin. Both of the dosages are going to be in there. Just make sure you know which one you're grabbing. Okay, so if you're grabbing the red one, it's going to be the 6 milligrams. And if you're grabbing the yellow, it's going to be 12 milligrams or the second dose. So let's set this up real quick.